Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. I'm going to be speaking with Dr. Jill Rabin this afternoon, professor of Obstetrics and Gynecology at the Zucker School of Medicine at Hofstra Northwell. She's joining us on the program to talk about the recent book that she co-wrote with Gail, Stein, and Danielle called Mind Over Bladder, a step-by-step guide to achieving continence. Welcome to Health Professional Radio, Dr. Jill Rabin.
Thank you so much. It's a pleasure to be here.
Well, of course, I mentioned that you are an award-winning physician. Give us a bit of your background. What brought you into obstetrics and gynecology?
I tried to keep an open mind. I was going into medicine thinking I would become a specialist in ear, nose, and throat because I did study audiology undergrad, but I did fall in love with delivering babies. Huh. I just couldn't imagine a better profession than helping bring life into the world. Wow, great. And that was a real thrill for me. So that started me out in OBGYN. And then after that, after training, my chairman said to me when I was already practicing at Long Island Jewish Medical Center and now Northwell Health, they said, we have an issue with women who have delivered babies, and as they age, they do start to leak, and we'd like you to study that.
Seeing patients with bladder incontinence or lack of bladder control, how many women would you say are affected by this particular condition?
It's interesting, Neil. There are 2 out of every. People think that this is an issue with older women, and the fact is this affects women of all ages. Actually, the statistics are that 2 out of every 5 women under the age of 60 and 3 out of every 5 women over do have an issue with either prolapse or incontinence or both. It's a very common problem.
You mentioned women who have given birth. Is it common for women to, as you say, leak after giving birth or as a result of that? And if so, is it something that just goes away, or is it something that can last into, as you say, your older years?
Well, actually, sometimes it does resolve, but most of the time it is progressive. And the important thing is to just be aware of your pelvic floor and your bladder to begin with, to do your Kegel exercises, your pelvic floor muscle exercises, which a doctor can help you learn and do and practice, and to keep up the strength of the pelvic floor in between deliveries. And women actually do leak more than men, and for many, many reasons. Our urethra is much shorter. Ours is only about 2.5 inches long, and the male urethra, of course, is much longer. So we have less tissue to squeeze and prevent that leakage. We also obviously have children. We go through menopause, so we lose our estrogen. Many other reasons associated with incontinence, such as constipation and obesity and coughing. So many reasons. However, incontinence it may be very common, but that doesn't mean that it's normal, and it doesn't mean that it is not treatable. It is treatable in most instances, and people need to know that. The most important thing is to find a doctor you can trust and get a diagnosis and make a treatment menu option so that from the beginning you can minimize this issue and hopefully have a dry future.
Finding a doctor that you can trust is, that's across the board when you're seeking medical care. But when it comes to incontinence, is that an easy conversation to have with your physician normally?
Absolutely not. The important thing is they call it the doctor-patient relationship because it is a relationship. And there's an implicit trust that has to be present. You have to know that this is somebody that you can speak to, whether it's an OBGYN or a urogynecologist, which is a specialist in female pelvic medicine, or a urologist, somebody you can bring your questions, write them down, because I go to the doctor and I forget what I need to ask. So writing them down is really important. And bringing your questions and making sure that you feel heard and listened to. Because if you feel like your problems are being not heard or minimized, or if you hear you need surgery right off the bat, well, surgery is an excellent therapy for some forms of incontinence, but it is by no means a first choice for many people. And if somebody tells you that's it, that's the only choice, that's just basically incorrect most of the time. So you need to be able to be heard and have a treatment menu option made for yourself individually once you have a diagnosis. and then you decide which of those treatments you want to try first, second, and third. People do not leak. Women do not leak unless the bladder pressure exceeds urethral pressure. And the only reasons women leak is there's a problem with the nervous system or the muscles or the connective tissue, or sometimes two or three of those. So if you figure out which of those is the issue, or all of them, or two or three of them, you can then develop your diagnosis and your treatment menu with your doctor and decide how you want to go about being treated.
Deciding how you want to go about being treated. Obviously, as you mentioned, there are several treatment options. I thought incontinence was incontinence. Are there different types?
Absolutely, Neil. Thank you for asking. That's an excellent question. People who have stress incontinence, remember I mentioned nerve, muscle, connective tissue. Stress incontinence is usually a weakness of the muscle and connective tissue so that when you cough, laugh, and sneeze, you have a spurt of urine.
Okay.
Urge incontinence, when you have that gotta-go feeling, you can't make it to the bathroom, that urge incontinence is a problem with the nerves that are trying to contract the muscle of the bladder during times where it's not supposed to contract. In other words, if you're saying to yourself, oh, don't go, it's not time, you start to do the pee-pee dance, we call it. And your brain, that's your brain. We call the book Mind Over Bladder because that's your brain trying to tell your bladder to not contract. And a good, healthy bladder won't contract or empty, but a bladder that has a problem with those nerves or muscles will contract and empty the bladder contents, which is incredibly embarrassing. That urge incontinence is very embarrassing. And the step before that is the gotta go. So if you have the gotta goes and you're not making it to the bathroom, getting a diagnosis and treatment menu is important so that you don't empty your entire bladder contents. So an early diagnosis and treatment, I can't stress how important that is. So that's stress and urge and mixed incontinence is when you have a problem with all three nerve, muscle, connective tissue, and you not only leak with cough, laugh, and sneeze, but you have the gotta goes also, and that's mixed. And those are three of the main forms of incontinence. There are others, but 95% of women who have incontinence have one, two, or the third type that I mentioned.
Are most patients successfully treated with medication or surgery, or are there instances where both are needed to treat the condition?
Well, the treatment menu depends upon your diagnosis.
Okay.
So for stress incontinence, which is a muscular weakness and connective tearing, surgery basically fixes the anatomy. It re-anchors the muscle to the connective tissue and the organs so that everything is in the right place anatomically. And that's always a choice if you have a dropped bladder, or we call prolapse, or dropped uterus. There are surgeries to correct this, but surgery just corrects the anatomy. It doesn't correct the physiology. So, for example, if you have stress incontinence and you want to try something else, the best thing to do is to keep your pelvic floor as strong as humanly possible. And the way to do that is pelvic floor muscle exercise on your own or with a physical therapist. There's all kinds of physical therapy that can be done for the pelvic floor. And even if ultimately you decide on surgery to re-anchor the muscles and the organs, and the connective tissue, your pelvic floor will be strong, the muscle will be thicker and stronger, and the muscle of the urethra will be stronger, and the surgery will last longer. We try to have just one surgery done for a lifetime if possible, and not more. If you go into that with a strong pelvic floor, and after physical therapy, sometimes you will not actually feel like you need surgery. The organs may be back where they may be lifted, they may be strong, and when you cough, laugh, sneeze, maybe the muscle of the urethra and pelvic floor is so strong that when you cough, laugh, sneeze, you don't leak. So there's physical therapy, there's that's one of the excellent methods, and then surgery. For women who are older, who are very debilitated, we do have these devices called pessaries, which are like diaphragms that if you use a contraceptive diaphragm, it's like a diaphragm of silicone, and there are many different types. Basically, that's placed vaginally, and you can clean it for yourself periodically, or your doctor can do it, or your nurse practitioner. And that basically lifts the organs for you. It's like wearing a strong tampon type. It would be a good analogy to lift the organs, and that sometimes helps with prolapse and incontinence. For urge incontinence, physical therapy works as well, because when you do those pelvic floor contractions, there's a reflex that quiets the bladder. So physical therapy, in addition to medications, are very good. We have acupuncture techniques for urge incontinence now called pretibial nerve stimulation, which we review in the book. And for people who have really bad urge incontinence, we can even implant a little pacemaker with a little wire that goes into a nerve near the spinal cord, and that quiets the bladder so that women do not have to live with urge incontinence either. Many treatments available.
Where can we get some more information online and also find out about you and your book?
Well, we do have a website. That's called and thank you for asking. It's called mindoverbladderbooks.com, mindoverbladderbooks, BOOKS.com. And that's our website. We have a lot of information there. The book itself is available all over, Barnes & Noble, Amazon, and so forth, through our website. And the book goes into detail about all of the things I've talked about today. And in the back of the book, we have very, very good resources. We have a list of products, bladder lingo, and organizations and websites that really help. And there's no reason that any woman should have to live with this problem.
Well, I appreciate you joining us here on Health Professional Radio, giving us this great information and giving information where we can find Mind Over Bladder, a step-by-step guide to achieving continence.
Thank you very much for having me, Neil. It's been a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jill Rabin. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download a SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.